We're here today with Jerry, who is currently the manager of donor recruitment at Vitalant, a national blood collection nonprofit. Thank you for joining us today. Can you
Thank you for having me.
can you start by briefly explaining how you got into your job and your field and like what it is that you do?
Sure. Well, I'm the manager of donor recruitment for Vitalant Blood Services here in New Jersey. And my career started actually back in 1995 when my mother was diagnosed with acute myelocytic leukemia. And at that point, had no idea what that was. But upon entering the hospital that night, she needed 3 units of red cells and 2 units of platelets. And the doctor simply asked her, "Jean, where is your blood?" So she was in big trouble when she got into the hospital, and she had to go through 2 rounds of chemotherapy before she finally went into remission. And while she was in remission, I decided to seek out a new job. And at that time, another blood company was hiring. So I went to work for the American Red Cross to try to help pay back and do something for other people, just as others had donated blood to help save my mom. So that was back in 1995 that I've been in business. So this year will mark 25 years that I've been in the blood banking business. And it's still the reason why I get up every morning, to help save lives, to give families and people hope, to give people another day through saving lives through blood donation. So it's a huge passion of mine. My job currently as a manager of donor recruitment, I am responsible right now for developing the Central New Jersey territory. Here in New Jersey, over the last couple of years, through hospital mergers and acquisitions, there used to be 7 blood centers here in the state of New Jersey, but because of all the acquisitions and mergers, we're basically down to 3 to 4 blood centers now. And so we're developing the Central Jersey area to get people excited about joining the Vitalant family and helping us to save lives and provide products for patients right here in New Jersey.
That's a really incredible story, and thank you so much for everything you've done.
Thank you.
Would you be able to quickly explain what is Vitalant's mission and how do you think that's been affected by the pandemic right now?
Sure. Well, you know, Vitalant is the nation's 2nd largest collector and distributor of blood products. And so we're very proud of that. Our mission really is to make a difference in people's lives by bringing together the most talented people, by encouraging people to donate blood so that we have a safe and adequate, ample supply of blood, advancing cutting-edge research and development, and embracing continuous quality improvement. That's our mission. And the bottom line to all of that is to save lives, to make sure that when the blood and the blood products are needed, that we have it and it's ready to go. And that takes a lot of people working together. We follow what we call our right values here at Vitalant, and the right values stand for respect, integrity, teamwork, and excellence. So in everything that we do, we try to follow those values. And if we follow those values, we will complete our mission every single day.
Yeah. So of course your mission is really important, but lots of people don't donate either out of not knowing about it or because of restrictions. Well, what do you think you can do to change this, or what common restrictions should people know of with the blood donation process?
Yeah, so that's a really good question, and it's really important because, you know, a lot of times people say, well, I didn't even know there was a blood drive, or nobody asked me to donate. And even though you might have flyers around town, or in some cases there might be a radio advertisement or TV advertisement, it doesn't mean that everybody got to see it. So a lot of people will say, well, nobody asked me to donate. And so, you know, that's very important that we get the word out. Here at Vitalant, we use all different kinds of marketing tools to get the word out to the community about the blood drives. And, you know, our website at www.vitalant.org is a great tool. There are a lot of resources there for people to follow. There's information there that they can get about eligibility for donation and how important it is to help and what kind of donations they can make. And that's very important also based on your blood type. What is the best way for you to donate? Because you might be able to help more patients by donating one way versus donating another based on your blood type. So that's very important as well. I think some of the most common restrictions that people will face when they're trying to donate blood, a lot of it has to do with their travel habits. If they've left the United States over the last 12 months, where have they gone? Also, any type of a medical condition or medications they may be taking. And also, something that's very, very important for people to remember is hemoglobin, which really is about their iron stores and their iron levels in the blood to make sure the blood is iron rich when it's transfused to the patient so that it benefits the patient the most. So, those areas there are the things that we try to get people to concentrate on and prepare when they're getting ready to make a blood donation.
So right now, we're in the middle of like the COVID-19 pandemic, and lots of organizations have been affected. How have you seen the change from your side? Because it's very reliant on like first medical assistance and personnel, which are kind of terrifying for some, and also people coming out of their houses, which is also another restriction that's been put on people.
Yeah, absolutely. Well, we've been very lucky and very fortunate. Some of the leading government officials have been very public about the need to continue to donate blood during the COVID-19 crisis. The Surgeon General was on TV multiple times urging people to donate. The CDC, other government officials, and our own organization has been uh, very forceful and very using a lot of tools to get the information out to the public about how safe it is to continue to donate blood during the COVID-19 crisis. Vitalant has taken extraordinary measures to make sure that everybody is safe, including the donors as well as our own staff. So it always starts with getting the word out, making sure that donors understand that one, right now we ask that they make an appointment. They have to wear a face covering or a mask when they arrive. Also, we take the temperature of our staff. When our staff arrive at the bloodmobile, they all have to take their temperatures to make sure that everybody is safe before they even begin setting up the blood drive. Then as they're setting up the blood drive, we sanitize everything, tables, chairs, equipment, blood pressure cuffs, anything and everything that's going to be used during the process of collecting the blood is sanitized before the operation. When the donor arrives, we ask that we take their temperature as well to make sure that they're safe and that there's no issues. And then as the donors are processed, we continuously are cleaning and sanitizing everything that we are using. We're also using social distancing. So we're making sure that all the donors are kept socially distanced apart correctly according to the official, 6 feet apart for everybody. And that includes waiting chairs, that includes how we're screening, how we're registering donors. So we've taken those steps to make sure that everybody is safe. And I can tell you, in being at several of those blood drives, the feedback from the donors have just been outstanding. They think that we've done a great job in making sure that everybody is safe, and that helps them to relax. And when a donor is relaxed and they feel comfortable and confident about the processes that we're using, it makes the donation process and experience that much better for the donors. And that will make them always want to come back. So I think Vitalant's done an excellent job in not only executing these new procedures and processes, but also communicating out to the public as to what we're doing to keep everyone safe.
Also, another very important point is having a constant blood supply. We had previously spoken about how after major disasters like 9/11 or like hurricanes, people rush to like blood drives and want to donate all the blood then. Can you tell us why it's important that people know that they should be donating blood all around the year, right now, whenever they can?
Sure. So, a lot of times we hear in the news, oh, there's a critical appeal or the blood supply is very low and we need a lot of people to come out and donate to make sure that we can build up the inventory. But the fact of the matter is that we're always on a timeline in the blood industry. A red cell sitting on the shelf can last for 42 days, but on the 43rd day, if it hasn't been used, we can't use it anymore. Platelets, once a platelet is collected, it has a shelf life of 5 days. So the need to continuously replenish the inventory is constant. Then if there's a natural disaster or if there is an accident or if there's something out of the ordinary that happens, that puts the urgency even higher on getting people to donate. So it's really about keeping a safe and an ample blood supply at all times. We like to keep 3 to 5 days worth of inventory on the shelf at all times. If we can get it, we like to get it up to 7 days. And platelets with a 5-day expiration date, the need for platelet donation is constant. We're always, and as the hospitals are ordering and the product is going out, we need product coming in, which means we need donors to show up every day and help and donate blood to keep those inventory levels safe. So while it is important during an emergency or during a crisis for people to come out and donate, it's just important to do that every single day.
Yeah, absolutely. So, given that, do you have any specific pieces of advice that people can take away from this interview that you would like to offer, just so that people can like find a blood drive near them, or what they can do at home if they can't specifically donate blood?
Sure. So if somebody for the very first time is thinking about donating blood, we encourage them to go to our website. And again, that's www.vitalant.org. There are a lot of resources on our website that will give you the information about the importance of donating blood, what you can expect during the donation process, how the blood is used, and what type of compatibility you might have after you find out what your blood type is. We offer donors to set up donor accounts where they can track and trend all of their donation information. So their test results will come back in. They'll be able to see a lot of information. We do cholesterol screening, so they get those results every single time that they donate. And what's really nice right now is that now through the end of August, Vitalant is doing COVID-19 antibody testing, which means with every successful donation, we're going to test those units for the COVID-19 antibody. And that information in the donor account approximately 2 weeks after they donate, but it's only for the donors and to help educate the public as to why it's important to donate blood. Um, that website is very, very important. Also, you donate blood to help save lives.
Yes, of course. Thank you so much for joining us. I'm sorry Gory couldn't be here, but we hope you and your family stay safe, and we hope that people learn about the importance of blood donation. Thank you.
Well, I want to thank both of you too, because you two are real pioneers in what you're doing, and you're everyday heroes. You are, and I've told you guys that before. I think you're amazing at what you do, and so we thank you for your support, and you guys stay safe as well. And the best to your folks. Okay.
Thank you. Have a nice day.
Okay.